Hello, everyone. So today I'd like to talk about a study that involved developing a predictive model for Guillain-Barré syndrome. Now, the purpose of the study wasn't to design a model to necessarily predict Guillain-Barré syndrome, as that is not really an issue for many neurologists. What really is a time-consuming task for them, however, is taking patients and dividing them into the various subtypes of GBS. Specifically, what this model does is that it's able to separate patients with GBS into four different subtypes, AIDP, AMAN, AMSAN, and MF. So let's talk a little bit about how it does this. So what this model did was that it essentially functions off of data collected from 129 patients with GBS. And effectively, it used three different types of tests in order to do this. It used serological test data, a clinical test data, and then neurological tests. And overall, you can see over here are the different features that it was focusing on. Specifically, what it focused on a lot was the extraocular muscle involvement and the different types of motor nerves and their effectiveness from the neurological test. Specifically, this study involved training the model to look at ulnar motor nerves, tibial motor nerves, peroneal motor nerves, and median sensory nerves. And in addition to that, this study also involved taking the artificial intelligence model and having it focus on other features such as ptosis and cerebellar involvement. Now, let's talk about the results of the study. So not only were four different categories generated through this model in order to separate the subtypes, but three different models were developed in order to see which model could perform the best at this task. And what they were able to find was that the C4.5 model had the best results. If you look at the table, you will see that it has the best results for accuracy, sensitivity, and specificity. Now, there's a lot of reasons why this could be the case, but the main reason why the authors postulated this was because the C4.5 model functions like a decision tree. So the reason why that's important is, imagine this. You have a group of patients that have very similar characteristics with GBS. So you group them together, and then you group the ones that are even more similar off to another branch. And you keep on doing this until you get different branches off of one tree. When you have that, you're able to effectively categorize a group of branches over to one category and another group of branches to another category. Now, the other models that were used were KNN and SVM. And although they tried to group patients that had similar characteristics together, they ultimately didn't allow for those groups to branch out. They simply clustered them together, and there was no way of actually differentiating the patients properly unless they matched certain characteristics. So while the C4.5 model essentially tried to separate everything out into much more small clusters, the KNN and SVM model effectively tried to combine everything into much larger clusters, which led to less accurate results. So I hope my explanation for this paper was something that was enjoyable and understandable, and I hope that you guys were able to see the result of this really cool study.